Good morning, afternoon, whatever it be, everyone. We have a founders exchange today with myself, obviously Hamish, and Dr. Kalli.
Thanks for having me.
Dr. Kalli is the founder of Toothpillow, and we're going to be looking at or really discussing kind of uh, its airway development, but particularly where you started was with kids, correct?
Yes, correct.
With kids, and it's something that we've dived a little bit into it, had a little bit of a pre-chat as well. That is, you guys were kind of the leading charge behind this. Obviously, it's become a lot more popular. Our audience is a lot of dentists, hygienists, assistants here. They know their dentistry,
Perfect. Yeah,
so they would have heard of a lot of this before and probably been ahead of the trend. But from like a consumer population, it's definitely something that people are becoming more aware of.
yeah, yeah. Oh, absolutely, it is. And like I was saying earlier when we were chatting, it used to really be this like not hush hush topic, but just a very blue ocean topic, bleeding edge kind of thing. And now that we have thousands and thousands of kids that have been treated so successfully with symptom resolution that would just like bring tears to your eyes, it's like everybody's like, "Hey, can I learn this from you? What can I do? I want to do it like you're doing it." And it's such a fun, wild ride, man.
That feel good though. They're all coming to you now, the Queen.
Yeah, no, I don't know. No, no, no. I don't like to think of myself like that, but I do love to teach and I love to mentor. So for me, it's like so much fun because when I believe in something, I am like the biggest cheerleader for it ever. Like all my friends would be like, okay, if you really want to like be sold on something, just talk to her because she's just like live, eats, and breathes it, which is true. So yeah, I mean, I'd love to be the queen of Airway. Let's do it. Let's go.
Can you take us through exactly how your offering, as it were, now, what you've become now works in order to prevent problems in the future for kids?
One of the simplest things is like how we breathe. And you would think like, oh yeah, we just breathe because it's this innate response of needing the oxygen. But when you can convert a child to being a nasal breather, you convert that child to a healthier, more developed jaws, and their sleep architecture is better. It's wild. It's wild how quickly these little faces with a little bit of mouth breathing start changing.
Those that are very young that naturally gravitate towards mouth breathing, their mouth will start to change shape.
Absolutely. Your whole skull changes shape. It is absolutely wild.
Goodness.
And it starts small, like maybe the parents don't notice it as much. And then one day they're 6 years old and they got to have their tonsils and adenoids out, or they got to have ear tubes. And it's like, oh, it just happened. It's like, no, it's been happening. But the signs and symptoms were so subtle, you didn't even recognize it. But the beauty about it is they're growing and growing and growing up until the age of, well, technically 18, but really by 12, boys are 90% developed in their head and neck at 12 years old. So you've got this window where I can redirect the breathing and I can redirect the muscles with something like a tooth pillow. And that is where you can broaden their arches and faces and start correcting so many of the symptoms that they're dealing with. It's just beautiful.
I have to ask here because this was may relate to myself actually at one point. What is some of the consequences of mouth breathing in terms of facial
Oh
jaw
gosh,
shape in
there's so many.
particular?
So one is going to be like just muscle wise. When you mouth breathe, your tongue is down. So if your tongue is down and it's not at the roof of your mouth, your palate's narrow. So you'll have a cross bite on one side or the other, or both. You could have an open bite in the front. Um, Typically, a lot of sinus issues. They'll tell you you have allergies and swollen tonsils, things like that, because the air coming in is not filtered. So there's so many.
Mm,
Snoring. By the time it manifests to snoring, you've got a serious oxygen issue. Tooth grinding, like, and so as an adult we give you a night guard, right? I mean, not in my office, but that's what I did for a lot of years. It's like, oh, you're grinding your teeth, here's something to grind on instead. And it's like, no,
yeah,
you need a sleep study, because bruxism and tooth grinding is a huge sign of sleep apnea, and it's
yeah.
happening in kids are grinding their teeth. And I mean, I just released on my own podcast a clip that was talking about the biggest regret I have is telling a parent that their kids grinding or snoring was normal and they'd grow out of it, because that's what dental school told me to say.
I actually think I probably was someone that mouth bred then because I had tonsillitis by the time I'm going to confess here, by the time I was
Oh my God.
4, I think I had my tonsils out. And then
Wow. I
actually I
know.
ended up
Oh
having to have
no.
and then I had a jaw operation because my jaw was
Stop
too far
it.
forward, which
Oh
I
my
have to say
God.
now, the more you're saying it, I've got a bit distracted on this podcast. I was like, oh, maybe
It's okay.
maybe we're talking about myself. It was a confession. Yeah, I had to,
Absolutely.
at the age of
Oh,
18, have a jaw operation
oh my
to move my
gosh.
jaw
So did they do
backwards.
upper and lower jaw surgery on you, or just the bottom?
No,
What'd you
just
have
the
done?
bottom jaw. But I'd already had the tonsils out when I
Wow.
was 3. So I'm assuming that I was in need of exactly what you're doing now, tooth pillow.
Yes. Yeah. I would say anybody in our generation and older, like absolutely. And the crazy thing is these appliances are not new. Like the idea of this in orthodontics, like myofunctional therapy, which is oral muscle exercises, and the actual appliances are not new to dentistry. They got taken out of the education. I think they like around 40 years ago, something like that. And
Okay.
that's when we started thinking a whole bunch of stuff changed. And there's all sorts of, oh, it was politics, it was this, whatever it was.
But
We are
the
the ones that
result
are
is where we're
suffering
at
from it.
now. Yeah.
Yes.
Right. Okay. So what age do you usually start with a kid when
3.
you've identified the issue?
Now, the
3.
zero baby, ages 0 to 3, there's a lot parents can do. That's probably my biggest DM right now on social media is like, my kid's 18 months old. What can I do? In my practice, I will see newborn babies and do tongue tie releases on them so that they can breastfeed and eat well and make sure that tongue is mobile and can move.
Okay.
There's so much that I tell the parents, like, you can do before you're old enough for a tooth pillow, which really truly is 3 years old. I mean, even at 3,
Okay.
it's still somewhat of a toy. But I started I have 3 kids, ages 9, 7, and 5 now, but I started my youngest at 3 because his tonsils were so swollen. I was like, he's going to have these out. He got a cavity because mouth breathing causes crazy amount of cavities.
I haven't
My
done like cavities,
own
I'll confess, but
son,
that was for
that's
great
good. That's
toothbrushing.
good.
But
Yes. Yeah, but the
but
mouth
okay.
breathing caused it on him, and he's a different kid. I mean, his tonsils are normal. He avoided the surgery. I mean, there is so much that we can do to try to avoid these the complications of having surgery, and even having it in general, which is very costly. It was very, it's very expensive. So
Yeah. So can you take us through exactly how does the tooth pillow work? How would you set a
yeah.
kid up with the tooth pillow? So they come in, they're 3. You've identified this being an issue that they may suffer from. How do you set them up? What do they have to do?
Yeah, so we take a lot of photos. Now, if I'm doing it through the Toothpillow Virtual, which is our Toothpillow company globally across the United States. I say globally, we're working on it, but over the United States right now. Um, and we evaluate that child's growth and development. So even in private practice, I'm doing the same thing. I'm taking pictures, I'm taking the width of their molars. I want to know how wide the roof of their mouth is. There is like an ideal width for certain ages. So like if they come in
Okay.
at 8 years old and they're measuring at a 4-year-old, like we're getting in there immediately. Like we've got to get this going before we lose our window. And the tooth pillows themselves look like mouth guards. Like to an untrained eye, it looks like a football mouth guard or something. Like
With
but
the
they
what,
are,
which I remember. So obviously a retainer you go and just put on your teeth.
yes.
Mouth guard is the back bit that goes up your palate, as I recall
Yeah.
from days of
Yes,
rugby.
that part's the expander part. But what we can do with removable appliances virtually is just the blue. Well, there are a couple of different colors, but they kind of look like this.
Okay.
Have you seen these?
Oh, I
So
see that. Yeah. Okay.
yeah, so you put it in around and your lips close around it and it forces nasal breathing. And these appliances cannot put force or do any damage or at all to the kids. They literally just get the muscles off the teeth. So if they're young enough, that might be all they ever use.
How many hours a day would you wear a device like that?
We only ask for an hour or 2 during the day, but we want you to sleep in it. That is the whole point, is to get
But you
that
can sleep
breathing
in
and
that device.
oxygen better. Yes, yes. That's what the kids are doing because it brings the lower jaw forward a bit, which is really important because the tongue is blocking the back of the throat, especially when your jaws are too narrow. They'll be like, "Oh, you have a big tongue." You don't have a big tongue, you have small
Mm,
jaws. So we put that appliance in and it brings the lower jaw more forward in a position it should be in and allows them to get air in better through their nose. So then you've got the hyperactive kids that are now resting and they're calm and they're waking up refreshed. They're not frustrated and angry and all the side effects that you have from poor sleep.
and then at a certain age, you come back, and the kids will come back into the office, um, and at this point, you will sit there and say, "Okay, you're done with it. You don't need to wear it."
Yeah. They eventually will age out of it. It depends on how young they are when they started. It also depends on how severe they were when they started. So some of the kids, if they have really underdeveloped jaws, I know that I'm going to want to guide that growth for as long as they'll let me, as long as the kids are willing to wear it, basically. And those appliances are all prefabricated to various widths. So they grow with the
Okay.
kids, which is what is so nice. And when we see them in office, or if I'm seeing them virtually, we're doing bite pictures. So I'm tracking
Okay.
what's happening with their teeth and going through with the parent of like, okay, they were snoring. Are they done snoring? They were tooth grinding. Are they stopping doing that? Bedwetting. That is a huge problem for kids that have sleep apnea and sleep disordered breathing. And there's a whole study on these exact appliances in regards to the resolution of bedwetting. It was monumental when we finally
Yet
got
they
that
didn't link
study
that back
completed.
to breathing, as it were.
Oh, absolutely.
That
Oh,
they
it is.
missed
It is.
like a final bridge though when these devices were coming out for bedwetting, they were just like, this is a solution to bedwetting without the link back to everything else
Oh,
that comes with
exactly.
Okay. My
Right,
gosh, that's
right.
frustrating.
And now they have it. Now they have it. And I'm like, oh my gosh. But I knew I was still giving these appliances out to kids that were bedwetting. Well, while the rest of the world's waiting on their perfect study, these kids are suffering. So that's me, though. That's my personality. I'm like, I'm going to fix
Mm.
you. Like, I don't need, I know that these can do no harm. And I know the physiology of the body and what these kids are struggling with. And when that bedwetting stops, you're welcome. Like, but it's so hard, though, because honestly, these kids come in when by the time they finally find either Toothpillow online or they find me here in Texas, like one person, they have suffered so much. They have spent so much money, the parents, on medical testing and sleep studies and just like the
And with
whole
actually
thing.
something that's
And
very simple and
nobody's
very
talking about
curable
oh
without
my gosh,
anything
yes.
invasive.
Yeah,
So tell me a bit about what you guys are doing at Toothpillow right now. So you have your practice. This is where you are. Anyone can come in. People
correct.
are they searching you out to find you? They're
They
looking
are.
you up, or they just happen to be someone in the area who you were advising.
I mean, at this point in my career, I have people coming from out of state. So it's really just, of course, in my town, people know that I'm here. And my day-to-day patient base is definitely children within our zip code, within an hour's drive or whatever. But that's why I needed Toothpillow. That's why we needed to start a virtual-based Airway
Okay.
company, which is the first of its kind. Because who else to link these families to the top trained airway dentists in the United States? I needed to build a platform in every state that you could
Okay.
get assessed by photos and a simple questionnaire, and you will literally get a video from your doctor explaining everything they see. So you're having a virtual consult. They get the video of me saying, look at this, look at your child's jaws, and this is linked to this, and this is what I see, and this is the treatment that they need. Sometimes it's not virtual care. Sometimes I have to deny them virtual care because it's too severe. They need expanders. They need something else that has to be done in office. And then they'll get referred appropriately for that.
Okay. And there'll be other people around the country that you trust, that you know in your network, that you can say,
Oh
right, you
yeah,
need to
we
be going here.
personally vetted them in every single state. You have to have taken the right training. You have to pass my vibe check. Like there's a whole bunch of
Okay.
things.
Yeah. No.
Like
Yeah.
yeah,
Fair enough.
we deliver it to them via mail once the dentist has accepted the case. So we have
Right.
our warehouse where we are packaging these. Obviously, as you know, all of these Toothpillow kids
Yeah.
get a burst toothbrush. It's beautiful. The unboxing videos have been stellar. But it is delivered by that dentist, but we are mailing it in that
Right.
state.
Okay. Love it. We're going to have to ask. We're going to go back a little bit of a step.
Okay.
Family history. What's your relation to dentistry?
Yeah, so I grew up in dentistry. I mean, from filing charts back when things were paper, which is just going to age me every time now that I say that. But I grew up in dentistry. I would answer the phones. I would be the cute little voice on the other end that would be like, "Hey, you're due for your checkup and cleaning. Do you want to come in and get your teeth cleaned?"
Well,
And
so
I'm
what
like,
age was this? Did this child labor
I
begin?
mean, 16. Like, it
Oh,
was like
16.
legal
Okay,
to
great.
work. Yeah, my parents weren't duty, but my parents are both dentists. So my mom and dad actually met in dental school.
Okay.
And they have three daughters. I'm the middle of three girls. My younger sister is also a dentist like myself. I'm married to a dentist, my high school sweetheart. We convinced him to also go to dentistry instead of architecture or engineering like the rest of his family. And then my
It must have
older
just been
sister,
easier for him to not resist after a certain point,
probably so,
actually. But well
honestly, he's
done.
like,
Well done.
everybody's doing. I know. My dad has so many friends, like dentist friends. They're like, how did you convince your kids to go to dental school? Because they're like, I would have loved that. It's a retirement plan for my dad, truly, is what it is, right? But yeah, it was wonderful. So my older sister, she is actually our regional office manager. We own many offices in the Texas, Houston area. And she's really the business mind of all of it, keeping us all straight and narrow. So it's a full family affair. It really is. Yeah.
So after this one, obviously finished dental school. You became a dentist, had a dental
Yeah.
practice, and at what point did you then switch to Toothpillow? Did you do it concurrently?
There was a lot of life lived and a lot of experiences had before Toothpill was even an idea in our mind. I focused on, just being a good general dentist, kind and empathetic, and built my own patient base of people that just, would be willing to come back for me to give them a shot in their mouth. You know what I mean?
Yeah.
And which I think is something that we really need to look at as a privilege because it's like they have lots of options. And I started studying biologic dentistry and holistic care, and that was a really cool niche for me. Like I really related to some of these families that were just looking for somewhere where they could ask questions and they weren't afraid to ask questions. I think in medicine, you can get really wrapped up in kind of like, well, this is just the way we do it. And then people just feel like they aren't able to ask certain questions. That was a fun journey for me. And airway dentistry really took it to a completely different level. So after lots of years of building a patient base from mom groups and family neighborhood Facebook pages around here, I spent a lot of money and a lot of time doing a very extensive postdoctorate education in Airway, which is funny because my entire goal for that was really to treat adults. I had no intention of treating kids.
You had the dental practice running, but you were like, I'm going to do an investigation in this one. Set up a
Yes.
group. This is very similar
Yep.
to how Burst, by the way, formed with me. I
Oh,
have to be honest.
amazing.
I
Yeah.
know, honestly, a complete plague. I was banned on LinkedIn once a week. I was banned on Facebook every 3 days because I'd be just peppering people with messages saying, I'm starting this company. I've got this idea. Will you just talk to me? Do you know
Incredible.
what was
Yes.
extraordinary is
Yes.
people would. There was so many like incredibly kind people. Actually, we were just in Dallas and I met a lot more people that we hadn't seen in years, but they were some of the first people that were on board with Burst who were like, I got your
Yep.
message 2016. Just this
Oh
is
my
something we're side
God.
noting here, but like
Yeah.
people can be so kind with their time,
Oh,
their
absolutely.
efforts,
Yeah.
and
And
just
I think we
like,
need to remember that and always pay that forward, just like how that
yeah,
was for us,
it
Absolutely.
goes round, and obviously we've done our
Absolutely.
bit, and you've ended up here because of it. So you had this group, you were sitting there, you were just asking them questions, you were trying to learn. Were you? Is this
Absolutely. Absolutely. And then the more I was doing this treatment in my private practice, by the hundreds and hundreds every single year, it got to the point where it was all I'm doing. It's all I do now too, but I was not doing any dentistry anymore, like general dentistry.
was what you were doing at the beginning of a similar route or the same route as what you've ended up doing with kids?
Well, it was very different because my intention was adults. And then all of a sudden it was like, oh my God, I can prevent this from ever being a problem. Like, why are we even
Okay.
talking? Why are we not talking about this? Like at the national level, like we are medicating kids for being tired. We are medicating them for things that have to do with their breathing and their sleep.
Mm.
And I just wanted everybody in the whole world to know it. I mean, like I said earlier, I'm a champion for things that I believe in. And all of a sudden I'm like, hey guys, hello, anybody see me over here? Like we've got this really incredible solution. But I realized it was so much bigger than me. It had to be so much bigger than just like my private practice here in Lake City, Texas. Like we needed to be able to reach, there's only so many hours in the day. There's only so many kids I could
Yeah.
physically see in my office in a day. And we're
And
like,
as you said,
we
also,
have to
if they
bring
weren't,
this.
if no one else was being trained on this from a young age, as you say, it wasn't part of the curriculum, there were less people to
It
know
was
about
not.
it. I'm sure people
Correct.
had seen it, but maybe not, delved as
Oh yeah.
deeply as you
And
did
you're
into
not
the
going to
subject.
just, yeah, yeah. And the
Okay.
education was super expensive. So I'm like, not only did you have to seek it out and want to do it, you also had to be able to afford it. And it
Yeah.
has to be put into the dental school curriculums. It just has to. Like it will. I firmly believe at some point this will just be part of your education.
And
But
that will
it's
be,
not right
and
now.
to your point, it will always be preventative with kids, or there will be there are people that have obviously gone through childhood, didn't know about it, and need help when they're getting older. Um,
Yeah.
you moved away from that completely as you sat there and said, actually, I can make a
No, I
difference
do
to
adults.
everyone's.
I no, I treat adults all the time. I love that. I moved away from restorative dentistry, fillings,
Ah,
crowns, things like
okay,
that. It got to where the airway part of the practice and the orthodontic side of the practice for both kids and adults was just on fire, and I didn't have
okay.
time for anything else. I didn't really want to do it anymore. I don't want to pull your tooth. Like I got somebody for that. My dad will pull your tooth. My husband will pull your tooth. That's
Yeah,
not
yeah,
what
yeah. We got
that's
the
what I'm
family
gonna
here. We
do.
got
Yeah, you
the.
just see him. He's better at it anyway. Like it was just a great sort of conversation for me. And I wanted to be the best that there was in this. And I knew that I couldn't be the best there was at this if it wasn't all I was doing. And it's all I think about. I am constantly reading the literature and writing magazine articles and just trying to get people to realize that this is even a thing because the general public awareness is very, very low.
And would you say it's also general public? Obviously, we're talking about dentistry. What about in the medical field? Like, if you were to separate, obviously they are in the same. But when you look at like doctors that are treating the kids that are coming who've got the actual problems, are they able to identify and say this is a dental problem? You need to
Yeah,
move to this side of
not well enough yet.
medicine.
But yeah, not well enough yet because they aren't taught the jaw structures in the mouth. Now, I do educate the medical community locally. We host dinners, and I will have everybody ENT, pulmonology, chiropractors. I don't care, whoever you are, like come listen so that we can work together because I need them as much as they need me. But we don't even know about each other, if that makes sense, right? Like as
Okay.
far as like how we can help each other. I will say the medical community is way more open minded than this about this stuff than the dentists. It has been really eye-opening. They are like, oh, yes, it makes sense. Like the roof of your mouth is the floor of your nose. If your palate is wider, your nasal passages are going to be wider. It makes sense. Where can I send the patients? Whereas in dentistry, it's like, oh, I don't think this thing. Oh, I don't. It's really odd. Like, and I'm like, what do you mean? You don't even know what you're talking about. Like, how can you have an opinion when you don't know about it? So anyways, that's been an interesting sort of journey for us as well. It's one of those things that I think you get set up in life for what you love to do and your purpose. And if you are a go-getter and you're going to get out there and tackle these issues, you have to have thick skin. That is for sure. And I do think I
Yeah.
was born with very thick skin because I've had, a whole life before this. But I love teaching and I love mentoring.
Okay, so we've got to end with a little bit of, just going back to that burst. Obviously, you, which is fantastic. We have a relationship. You include a burst toothbrush in every toothpillow box that goes out. How did we win you
Absolutely.
over?
Oh my gosh, your packaging and your design, guys. Like it's just so great. It's so great. And my kids were actually using the burst toothbrushes before we started with
Were they?
Toothpillow too. So I was like, yeah, yeah, we were hosted in the office. We have burst toothbrushes in my offices. And I just loved it. And as Chad and Michelle, Chad's our CEO and Michelle's our president, we would have these late night Zoom calls, as you probably did too with Burst early on. And we're like, what are we going to do? How can we deliver the best patient experience? Because your toothpill boxes are a really fun patient experience.
Yeah,
So
there was a nice little
private
calendar.
practice, yes. Oh my gosh. And so, but even in private practice, like typically you get a toothbrush, it's like one big box and it's clunky. And like yours is so much fun to open. There's like little slots, and oh my gosh,
Yeah,
we just like it
I
was
was
a
a big,
really
just to
important
confess, I was a
discussion.
very big advent calendar guy growing up.
Oh,
I don't think I
makes
ever
so much
actually
sense.
got to the 25th without eating most
Stop
of the
it.
box. I was kind of that way inclined, but that was kind of a lot of where it came from. I swear they're not quite as big in the US, big in the UK. So we're looking here. We've obviously got our amazing bursties. We'll be sending this out to all of them. What information? Obviously, they're going to get so much information from our conversation here. What information would you like them to take from this? Like, what actions can they do? How could they get involved if they'd like to? Speak to us.
I mean, anybody that's listening to this, I would hope that it would just prompt them to ask more questions to their dentist and their provider. Obviously, I think every child in America, literally nearly every child, is suffering with sleep disorder breathing of some kind. And they don't know what these signs and symptoms are. So many things that we think are normal because they're common, but they're not actually normal. So I would empower every family that if you have a child 12 or under to submit virtually just to get a consult. Like, what is it going to hurt to hear what a highly qualified airway dentist has to say about your kid's growth and development? Because I truly believe that this decision that these families are making is the best one that they will make for their growing child, because it will literally alter the way they turn into an adult. And I don't want any of these kids to have half of the orthodontics I had. I don't want anybody to have jaw surgery like you have if they can help it. And so if we can get in early and correct this, we are going to have better learners. We're going to have better kids that are entering society.
Thank you so much for coming on. You're doing extraordinary work.
Thank
We love it.
you.
I know my
Thanks for
team
having me.
absolutely loves working with you. So thanks for
Good.
coming on. Keep smashing that ice.
I appreciate
I
it.
feel I can see your thick skin. You
Same.
have to be. You have
Yeah.
to be as a
Thank
business
you.
leader. You just got to keep plowing on. A
Yeah.
lot of people will tell you it's not a good idea, but you've clearly proved it is. So again,
Thank
thank you
you.
for
I
coming on. Thank you for
appreciate it.
doing what you do.
Yes, absolutely.
And we'll stay in touch.